guys want to come around in back, probably? Yeah. All right, we ready to go?
You are now.
All right. Okay, well, good morning, everyone. Thanks for joining us here. We have as a backdrop today the historic state office building, which over the last several years, you're probably all aware, was renovated to bring it into the 21st century, both in terms of investments that were made in new technology and new spaces that enable our state employees to work together more efficiently, in terms of reorganizing the space to enable us to consolidate a number of other state office buildings and save the taxpayers some money. And so it's a good backdrop as a metaphor for what we're here to talk about today, which is the governor's broader strategy and vision for modernizing Connecticut government operations. One of the first steps that we took in the Lamont administration when we came into office to fulfill the governor's vision for modernizing state government was to start looking at the business functions of state government, the support functions that provide services to all of the other executive branch agencies to help them do their jobs. And we started with human resources, a function which previously had been run independently in each of our major executive branch agencies, and in so doing was operating somewhat inefficiently. We had a lot of people reinventing the wheel, interpreting rules and contracts slightly differently, and trying to figure things out in their own silos as opposed to working together as one team to solve similar problems. And so the governor's second executive order, before executive orders became household terms in the pandemic, executive order number 2, if you can remember this, back in July of 2019, directed Secretary McCaw and myself as Commissioner of DAS to undertake a centralization of our human resources and labor relations functions within state government. And so we embarked on that work. The pandemic certainly slowed us down a little bit as our HR and labor relations teams pivoted to support our commissioners and our employees through the pandemic. But the teams continued to make great progress. And last summer, in August of 2020, we went live with the new centralized model. And so we're here today to give a about 8-month report card on how things have gone so far. And the good news is, although any type of change like this is a constant process of continuing to improve, overall the results have been very strong. And I'll give you a few examples of why we feel that way. So first of all, when we went live in August last year, we inherited from the 16 major agencies that were in scope for this initiative, a very wide distribution of quality and consistency with how we apply, leaves and benefits as an example. So we had a 500 case backlog of family and medical leave processing to do. We had 50 military leaves that hadn't been processed. And we had a lot of agencies that were in an unsatisfactory position with regards to how they were interpreting and applying our employee contracts, our laws and regulations that govern how we run our personnel. Since that period of time, those backlogs have been completely eliminated, and we have, through our specialized pods, have created process consistency and quality with how we administer these benefits that put the state in a much better position, which helped our employees get much faster answers to their questions and their requests. So that's one example. Another example is with regards to technology. When our agencies were operating in their own little silos, they didn't have the time or the resources to invest in technology to help make their jobs easier, improve the services we provide. As we've brought the centralized teams together, we've had the ability to invest in technology. So we've digitized our personnel files, literally hundreds of thousands of pieces of paper now digitized, moved online so that people can access them from anywhere at any time. We're using other technology solutions to help automate certain manual low-value tasks that our HR professionals had to slog through before, now enable them to spend more of their time on the high-value support of our commissioners and our managers and our employees. So that's another example. A third is around the risk that we face as a state with regards to the retirement cliff that's coming. So in scope for this centralization initiative are about 350 people across those 16 large agencies. We expect about 140 of those 350 people, so about 40% of those people to retire in this coming wave that we're in the middle of going through next year. by centralizing, by standardizing these processes, we expect to only have to refill half of those retirements. So about 70 of those 140 roles will need to refill. So between those savings, with less people needing to be rehired, as well as some offsetting investments in the new technology, we're expecting to save about 20% on the cost of the HR function for the state of Connecticut. So that's a meaningful improvement in the cost structure of state government, which will help our long-term structural budget challenges as we look forward. And then finally, another area that we're really excited about is the benefits that this centralization provides to our employees as well. So anytime you have a lot of people retiring, particularly people who are deeper in their career, they hold a lot of management roles, a lot of supervisory roles, that creates new opportunity for people too to step up into new challenges. And you're going to hear from Bernice in just a moment, who's one of those people who, through the context of this reorganization, raised her hand and said, I want to take on a new challenge. And she received a promotion into one of the leadership roles in this group and has been doing a fantastic job. In addition, I mentioned there's 70 more people we need to hire, and that's an opportunity to bring new talent into the state, new ideas, new perspectives, and you're going to hear from Tiffany in a moment, who's one of our new hires, who's been doing a great job leading the implementation of that online personnel file system that I referenced a moment ago. We've also been able to reinvest some of the savings from this initiative in rebuilding workforce training supports. That had been kind of cut back over the prior administration, where we didn't really have a centralized training function in the state. We've now built that back, and we're providing new training resources, including access to LinkedIn Learning, which has an incredibly broad catalog of training resources available to all of our employees, which is rolling out. So a lot of exciting opportunities for our employees as well in the context of this. So I'm going to turn it over in a second to Nick, but first I just want to thank in particular our partners in this effort. Secretary McCaw is my number one partner in all of these work. We're joined at the hip, and through her leadership and support, we've been able to drive this forward, but really the work gets done with the team. Deputy Commissioner Nick Herms is our Chief Human Resources Officer for the state. You're going to hear from him in a moment. His counterpart at OPM on the labor relations side is Undersecretary Faye Brown-Bruton. Them and their teams are the ones really driving the change. This is hard work. It's much easier just to leave things the way they are and accept the status quo, but we've got a lot of great leaders in this state who are excited about progress and pushing things forward and making the services we provide better, more efficient, creating opportunities for our employees and looking out for the taxpayer interests as well. So really want to compliment them and thank them for all their efforts. I'm delighted to introduce Deputy Commissioner Nick Herms.
Thanks, Josh. And thank you, Governor Lamont and the entire administration, particularly great agency leaders like Deputy Commissioner Jody Hill-Lilly here next to us right here. This has been an exciting year. After about a year of planning, we went live in late August of 2020 with our centralized structure. And I thought Josh gave a great summary of where we stand right now. But maybe just to add a few additional key points here is we've developed a contemporary shared services model of HR service delivery here at the state that models much of what the private sector and many other government entities and enterprises across the world do. We're finally in a contemporary structure where we can be as efficient and consistent as possible across the state. Perhaps just to reiterate what Josh said, historically, all state agencies had their own unique HR offices. They were designed differently, they had different processes, different policies, down to different forms, and down to different philosophies on how they interacted with management and their own employees. That has largely changed, where we act as one employer now, as the state of Connecticut here at the executive branch, where we have a consistent HR structure that interacts with agency leadership, management, and employees in a consistent manner. So it's really wonderful to see that we're at this stage here where we have an entirely new structure and it's operating really outstanding at this point. We have, with a large initiative like this, it's going to be years in the making to fully realize all the benefits that we envision for this structure, but we're well on our way. One thing that I'm really excited about here is that also our new structure, it's resonating with our top in-house HR talent. people have been raising their hand, like Josh explained, to take new roles and to take new leadership opportunities to move us forward. And also, our opportunities have been attractive to college graduates and other HR professionals in the private sector that see what we're doing, see the changes that we're making, and they really see that their skills are transferable here to the state, where we can grow and develop and deliver outstanding HR service right here in state government. I'd like to introduce first one of our supervisors in our FMLA unit, Bernice Morgan. Bernice raised her hand. She was an HR professional at DCF. She raised her hand and competed for a promotion to supervise a unit that administers leaves for all of our state employees. She works in our public safety pod, and she's done an incredible job. And she's one of the main individuals and team members here that have helped knock down all of our backlogs with leave requests here at the state.
Thank you, Nick. Good morning, everyone. Again, like Nick said, I actually came into this position. I actually had a chance to volunteer to apply for this position when it became available. And I must say that one of the attractions that brought me to the position was the fact that, you know, I've had a chance before of working in HR where it was possible. If you ask one question to 5 different HR professionals, it's possible that you can get 5 different answers regarding a process. And one of the things that just attracted me to this particular position was the fact that knowing that, you know, employees can have one central location where they can go to get consistent answers to their questions. I particularly like the family and leaves benefits, just, you know, working with employees and just having to know, you know, they can be reassured that if they have a question, they don't have to go to different people to get different answers, or, you know, they can just come to that one central location and get that answer. Me personally, I've experienced the processing times in processing FMLAs. When you have to go to different agencies, if a person transfers to an agency from one agency to the next, you have to track down personnel files and medical files to get information on the last leave that they had. You know, just being able to, you know, go into People Docs and just pull up an employee and see where that last leave was helps in the processing time tremendously. I've actually seen and timed it one day where I've cut down. It can actually take upwards of 45 minutes to process one FMLA request. I've seen it cut down to where you can process. If you go into People Docs and you have the information that you need, you can actually process a request within 15 to 30 minutes easily. And just taking out a lot of the extra information that you have to go and tracking down information. So that's been my experience with the FMLA benefits leave unit, and to me it has been challenging. It's been rewarding, and I like FMLA. I like processing FMLAs, and it's been a rewarding experience for me thus far.
Thanks, Bernice, and thank you again for all the great work that you've done. You've made a tremendous difference in making this initiative successful. And then another example that we have is we have Tiffany TRAN here. Tiffany graduated from UConn with her master's in public administration last summer, and we were fortunate to scoop her up. And she works in our HR information systems unit. She is working with a small team she onboarded and implemented our HR service delivery system that is responsible for scanning all the documents that Josh mentioned, and is responsible for creating a lot of the case flows that are automated that employees have at their fingertips to use now. And it's really what interconnects our entire operation, and it connects us with our customers, our state employees. So Tiffany, come on up.
Yeah, thank you, Nick and Josh, for allowing me the opportunity to speak here today. I always knew that public service was something I wanted to go into, and when I graduated last May, I wasn't too sure where my career was headed, and especially during the middle of a pandemic. But while I was applying to jobs in pretty much every sector possible, I always had a feeling that state service was where I really wanted to be, especially during a time where it was undergoing so much positive change. To be given the opportunity to be a part of that change was something that I couldn't think about passing up. Fast forward several months with HR centralization now underway, it has been an incredible experience to see firsthand an increase in accessibility and efficiency for DAS and the statewide services. With the implementation of our new HR service delivery system, it has allowed for employees and myself to securely access documents in centralized location. It's really cool to know that my colleagues and I could be looking at the same document online at the same time and be on opposite sides of the state. And I think this really does help in terms of saving a lot of time and allowing me to focus on the part of HR that truly matters and enhancing the employee experience for all. HR centralization has not only provided me the opportunity to learn the functions in my own unit, but has allowed me to learn from other functional units like FMLA and the other state agencies. I'm continually learning new skills and applying them to determine effective solution on how to continue enhancing statewide processes. Ultimately, the work being done here now will have a lasting impact and will set a new standard for state service and my own workplace experience. HR centralization has played a positive role in my career, and I'm confident it'll do the same for others. I'm extremely grateful to be a part of this project and to be working with an amazing HR team, and for it is our work together that got us here today. Thank you for your time.
All right, thank you, Tiffany and Bernice. I think you get a good glimpse of why this project has been going so well and the great talent that we have on the team here. Nick, thanks for your leadership. I'm now delighted to introduce DCF Deputy Commissioner Jody Hill-Lilly. When we're talking about the business functions of state government, we're providing services, right? We're providing services to our agencies, all of which have a mission that they need to fulfill. So there are our customers in this effort. So Jody is here as one of our customers to give us a report card on how this has been going, and to provide the perspective of how this initiative is helping our agencies fulfill their jobs. Jody.
Good morning. First of all, it is super exciting for us to be a part of what I'm going to call a movement in state government. And kudos to the administration for taking this on. More importantly, we're moving towards the quality of services that our children and our family and the people who come to receive services from the state deserve. We've been able to partner with DAS to make centralization happen during a pandemic. I meet regularly with Deputy Commissioner Herms, both to strategize and to troubleshoot. To this end, we want to make sure that we have consistency, efficiency, and high standards of practices across state government. For us at DCF, through this process, we've actually identified some real strengths in some of our processes. We've also identified some areas needing improvement and areas that needed to change in order to be consistent with the rest of our state agencies. The magic in successful implementation of change, particularly of this magnitude, in my mind, is finding that balance between customization and standardization. Because all the agencies are not equal. We all have different policies and regulations and rules that we have to follow. But I'm happy to say that we are doing this. In a recent staff meeting, we discussed HR centralization and its impact, which I do regularly because I think it's important to check in on how we're doing. And I receive feedback from both our HR staff as well as folks who are on the receiving end. We've identified significant progress, I'm happy to report, and we've identified the pain points. We've made the change, but we are still in transition, and we are partnering together to make this successful. I'm excited about this new system. I'm excited about the future. I am a 32-year vet at the department, and I am one who embraces change. I believe in the theory of implementation science. And what we know about that is that without change, there's no progress. And without change, there's no growth. So we embrace this and look forward to the future.
All right, thank you, Jody. So we wouldn't be here, and this initiative would never have happened if this was not an area and a subject that was set as a very high priority from Governor Lamont from day one. And it's really been his leadership and his direction and his desire to make the state better, to improve how we provide services in this state, both internally to customers like DCF and all of our other agencies, and through them externally as well to the constituents of Connecticut. So we're so grateful for the governor's leadership and vision, and delighted to have him here with us today.
All right, good morning. Hey, thank you, Josh. little music to my ears. I mean, our chief operating officer talking about our families, DCF, is like our customers, people we care about, and the customer is always right. That's the world I come from. And Jody, hearing you talk about implementation science and what this means in terms of how we can streamline our services. And I think I saw in my briefing, if we're going to have maybe 140 fewer people in personnel across the state, we're going to have 70 people coming in to replace them in terms of incredibly high quality, and I want to emphasize the quality of what we've got to do. And I think we are leading by example here a little bit. Early on, I thought our towns could do a lot if they wanted to share a lot of back office services, like we're doing with technology, like we're doing with personnel, like we're doing with purchasing, and they worried about their feisty independence, so we're leading by example. We thought that our community colleges can probably save a lot if they wanted to share those back office services, and what a difference that could make. There'd be more money to put in the classroom, more money to put in the scholarships. And that's what we're trying to do with the state government. And I really appreciate, Josh taking the lead on this and what a difference it makes. And I want to just say one other thing, because personnel sometimes, Nick, doesn't get the respect it needs. Here in state government and in the private sector, it's all about talent. And whoever has the best talent is going to win. And we prioritize that every day. And, I get the sense that every 4 or 8 years here in state government, it's like the final scene. We're trying to find out who I can get to be commissioner of this or that. And it's a scene from Casablanca. Bring in the usual suspects. Round up the usual suspects. And they're often folks who come out of the political world, maybe from the campaign, maybe they're advocates here, and you know them from their advocacy on this or that. And these are all really important people to have in state government. But it's also really important to have people who manage and know how to manage with heart. And that's what we've tried to do over this last 2.5 years. As we compare notes with public health folks across the country and how they're doing COVID. I mean, I'm really proud of, the team we've had here. And knowing as we manage our way through COVID, it's a supply chain issue. It's an inventory issue. It's a marketing thing. Ways that we can deliver, in this case, vaccines to more people faster than anybody else. That reflects upon Josh, the team he's been put together, Nick and the group that he's able to attract. And if I could do one thing, it's widen our outreach in terms of the type of people I want attracted to state government. And that includes, when I say a nationwide search, that doesn't just mean coming from California or Georgia so we get the very best practices from other states. It also means people coming from the public and private, non-sector, and the not-for-profit, coming from a different types of backgrounds that they can help bring as we try and blend skills in order to deliver a better product, to our customers. And I often found you don't have to look very far. I mean, Jody, Vanessa was right here, Vanessa had been taking care of kids on the front line for, I think, 20 years. And you can sometimes find the very best people you need. And you respect the amazing folks that are working in our departments and give them an opportunity to step up and take on more responsibility. And you find big things can happen. And state government's a pretty big operation. And I have to be able to attract the very best people to run each and every one of these departments. And they have to be able to attract the best people to be their deputies and beyond. And I got to give people a sense that this is a place you want to be. This is a place you're making a difference, either for your career or for this part of your career. And as I look out, the TV cameras and tell each and every one of the young people, when you're thinking about what you want to do, also think about state government. I think you've seen over the last year that good government can make a difference. I think you see in terms of DCF what that means in terms of our kids. When it comes to the environment, what that means in terms of combating global warming and making a difference. What you've seen in terms of COVID, keeping our people safe and getting us back to a new normal. I can't do that without the very best people that we can attract to state government, and that's why we're here today. It's more than centralization, it's more than streamline, it's more than technology. It's about really attracting the very best talent and then giving them the green light to go get the job done. Thanks for getting the job done, you guys.
Hey, Josh. Without interrupting the Mockingbirds meeting call, can you give me a ballpark figure on what the dollar figure would be on saving 20% on HR functions at this point?
Sure. So in the governor's budget for year 2 of the biennial budget, I believe there's $6.5 million of savings. That does not include fringe benefits. So I think when you include the fringe benefits, it's closer to $10 million.
What?
$10 million annually, once fully implemented. Yes.
Mr. Governor, can you talk a little bit about the Boston Consulting Group study that came out about a month or 6 weeks ago? Does it dovetail into what you're announcing today? And how are you going to treat that study? I mean, a lot of people take studies and put them on the shelf. I would guess you're not going to do that.
That's a big waste of money. Here's what. I mean, back in 2017, the legislature wisely said, I think you got to do an independent study. We have a waiver of retirements, other efficiencies you can do. I think it came out of that Fiscal Stability Commission. It said nothing worked on it. We worked on it. We got a pretty good study going forward. And now we bring that study and it confronts reality. We take the very best ideas, see how we can implement them. I know people belittle these studies, but what they do is they give you some of the best practices from around the rest of the country, what these groups see from other states, and we can learn from that. So it's not going to sit on a shelf. It's going to make a difference, and we need it. We got a lot of people retiring. I don't want them to retire, but for some reason they want to retire, and I got to make sure that we replace them with people who can get the job done.
In addition to having departments with their own HR people, there's a pattern in this state of having job classifications in each department. You may have a specific classification for a custodian at DCF that's slightly different. So how does that work? Where are you guys in that process of simplifying the job classification?
Well, I'll start and then hand it over to Josh when I see him start getting nervous as I talk. But I think these job classifications are too narrowly defined. And I think it makes it tougher for managers to put people in the job so they can be most effective. And it makes it tougher for state employees to rise up and do more than they often want to be able to do. So I think it is somewhat narrowing. It's something we ought to be talking about with labor. Go ahead, Josh. Go ahead, Nick.
Thanks, Governor. Well, I think what Jody mentioned earlier about a balance between what's specialized and what's more structured and more consistent is, I think that's applicable here to our job classifications in the state. We've got roughly 6,000 different job classes. We can certainly continue to drive that number down, but there's going to be a tipping point. There's a balance because not all jobs are endemic to every state agency. So we're going to need, to a certain extent, some specialized jobs for the agencies because our agencies do a wide array of different occupations and services. But we are regularly working constantly to find ways in which to standardize these so that when they're not endemic to any one particular agency, that we can scale those and use them elsewhere in the state.
The BCG report, though, mentioned side-by-side buildings where somebody can do maintenance on one building but could not on the other. So how much of that is a function of contracts and what progress have you made as far as addressing that kind of inefficiency?
Well, I think it's a combination of how we draft our job classes, but it's an interconnected web of statutes, our corresponding job classes, and our collective bargaining agreements, and those are something that between the governor, Josh, myself, the team at OPM, we constantly work on to try to make that more and more efficient.
But have you engaged labor yet in making those changes, or is that to come?
Well, the state is in the middle of contract negotiations right now, so that remains to be seen what the outcome will be. But absolutely, the state has a number of these items on the docket to negotiate.
In terms of replacements, do you have any kind of caps in mind? If was it 8,000 could retire, if 6,000 retire, we'll hire back this many, but no more than that. I mean, is there any kind of sort of gradation, I guess, caps and stuff like that?
No, I mean, that's going to be part of the budget negotiations, of course, with the legislature as well. But it's not a one-size-fits-all approach, right? So, for example, in this particular function, HR, we see opportunity for savings and efficiency to be able to do the job even better with fewer people. In other service functions, it may be a different approach. Like, for example, in the work we're doing to centralize our IT function right now, similar play, but in that case, actually, we're looking to refill every single role because we can do so much more with technology in this state in enabling our agencies to do their jobs and provide services much more efficiently and higher quality to our constituents. So it's a different equation for each of these different plays. So there's not a set formula.
In addition to the $10 million from the HR, do you have any other estimate of the total savings from streamlining proposals from like the IT and anything else in the budget
Sure.
overall?
You can go in the governor's budget proposal, right? And there's a list of similar initiatives that are outlined there. That I believe in year 2 of the biennial budget is about $115 million in savings in total. The BCG report outlines an even longer list of potential opportunities, as the governor said, that we're in the process of evaluating and determining whether to pursue and over what timeline. So, yes, there's a significant amount of opportunity.
The introduction?
Yes.
Okay, thanks.
So, coming out of IBM, can you talk a little bit about where the state stands technologically? And is this things that were outlined today, are they happening, or are they going to happen, or have they happened? What's the state of these technological improvements? Talk a little bit about where the state stands in terms of your background in IBM.
Okay, so the question is, relative to my background at IBM, where does the state stand on technology? I think it's safe to say we have a lot of opportunity here at the state of Connecticut to better use technology to get the job done. We have made a lot of progress already in 2.5 years, despite the pandemic, under the governor's leadership. The things you heard about today have been done. They are done. We are using PeopleDocs as our HR platform to do everything electronically. Other examples, we announced last summer the business.ct.gov, the one-stop shop for businesses across the state. Department of Motor Vehicles is doing online vehicle renewals. We announced that 3 months ago. In that 3-month period of time, that has become the #1 channel through which Connecticut residents are renewing their driver's licenses now. In 3 months, went from 0 to #1 channel. So it's an example of the demand that is out there from the people of Connecticut for more modern online services. So yes, we have a lot more room for improvement.
And what's up to now, was it money? Was it culture? I mean, digital technology has been around now for maybe 20 years or so, late 90s, early 2000s. Was it money? Was it the culture of the bureaucracy? Was it leadership?
I wasn't here at the time, but what I can tell you is that this type of change doesn't happen without the tone from the top, right? It starts with the governor. It starts with the governor back on his campaign, on the campaign trail, talking about these topics, making it clear that this is something that he cares deeply about. He wants this to be part of the legacy he leaves the state of Connecticut, that we are running the state in a more modern, more efficient way. We're providing better services to people. It's not always the most glamorous work, but it's something that he put the stake in the ground very early on. And this type of change and transformation does not happen without that type of leadership.
And Governor, I had one question. Have you been in touch with labor leaders about this, and what kind of, are you getting pushback? Are they cooperating? Are they, what's happening on that front?
No, we're talking. We have a good, strong, collaborative relationship, and we're going to keep that communication going.
Governor, can you answer some questions off topic?
Sure.
Your decision yesterday to lift pretty much all the restrictions. We heard from several people, a majority in fact, who feel it may be a little bit too soon, that we haven't reached herd immunity, children haven't been vaccinated. What do you say to them?
I think I heard that May 20th last year when we opened up for outdoor dining. And I think we've spent the last close to a year slowly, cautiously reopening in a way that I think gets our economy back, allows people to get back to work and keep people safe. And I think overall our infection rate has stayed steady or gone down for most of that period. A slight blip, Thanksgiving through January during that. And I'd like to think that if the world changes and I got to change course, we're prepared to change course. But I think you're going to find on May 1st, being outdoors is safe, and that was the decision we made. And then come May 19th, I think you're going to find more things open, but still making sure, working with my friends in the legislature, that we wear the mask a little bit longer when we're indoors.
You've said in the past, when making decisions regarding restrictions and COVID, that you've consulted the reopening committee. Did you do that in this latest event, or was it just within your own administration, or do you always consult with the reopening committee before you decide to change or open things up?
Well, the reopening committee is no longer a formal structure, but they're informally friends. So I certainly talk on an informal basis with them as much as I can. I can hear that Deirdre Gifford talks on a regular basis with her counterparts, not only in the hospital leadership here in the state of Connecticut, but also public health officials around the country.
Do you ever consult with other states on what they're doing, or you stay focused here in Connecticut?
Well, she definitely consults with other states on, I think, a regular basis, weekly.
I just wanted to clarify, because I thought you said this yesterday. Sorry to ask another question again. But I couldn't seem to find it on the tape, and my notes weren't clear. After May 19th, will it be necessary, in your view, to have some sort of continuation of an emergency declaration that would allow you to act unilaterally with executive orders, in addition to whatever you might negotiate with the legislature?
Yes, we want to keep an emergency declaration in place. That certainly facilitates a lot of federal FEMA funding, so that's very important. And Nora Dennehy, who was our general counsel, is working very closely with both parties in the legislature, trying to narrow the scope of the executive orders specific to public health, a number of things we'd like to continue so we can keep managing the response.
If you should happen to need to issue additional orders pursuant to this continued declaration, what will you be consulting the legislature? Well, I mean, how will you proceed? Will you proceed like you have been, or is it going to be a new system in place?
Well, we've always been consulting the legislature. I need them on board. And I think, generally speaking, we tended to agree. They've always had the opportunity, if they disagreed, to say so publicly, which they're not shy about doing, or even to, pass a bill to do that. Going forward, I think we're going to have some powers within the public health executive orders that allow Josh and Deirdre to respond quickly as needed if the circumstances change on vaccinations or variants. But it's going to be narrowed to just those areas.
Will it be a civil preparedness order too? Is it just going to be a public health emergency, or will you be doing another sort of joint declaration?
I think it's going to be both, but let me get back to you on what we need.
I'm sure you were not up at 2 o'clock in the morning when the House finally voted this morning, but you must have heard what the results were. And I understand a couple of amendments passed, but some say this could be a difficult thing to implement, especially with school districts. What's your reaction to the vote and that issue?
I was asleep, but my iPhone started shaking, and Jonathan Harris was not asleep. And we saw that it was a very strong vote in the legislature, which I consider in support of vaccinations and doing everything we can to encourage, in this case, students to get vaccinated, with obviously the necessary medical exemption. I think we'll be able to implement that. I don't see any reason why we can't do that, and I think it sends a strong signal, which I appreciate. Get vaccinated. That's how we get COVID in the back rearview mirror. Thanks, everybody.